A lot of our patients come in and they've tried the prescription medicines and the over-the-counter medicines, and they've looked into surgery, and stem cell therapy is a perfect alternative for them, and we've seen the results. So we've seen where people were scheduled for surgery and no longer need the surgery because of the results of the stem cell. The majority of our stem cell patients initially are coming in because they've done everything else, they've tried everything else, they're in a tremendous amount of pain, and really it's their last resort. These people are unable to play with their kids, or they can't golf. I have a patient who couldn't lift their shirt over their head, couldn't get dressed themselves. So we're seeing incredible results and changes after stem cell therapy is done, and just mobility and independence and their opportunity to be able to give their self to others. Once it's bone on bone or grade 4 degeneration cases, I can't help them with chiropractic. I can't put cartilage back in there. So it was the one thing that I felt like that would fit with my core values of allowing the body to naturally heal itself, that would regenerate cartilage or bone or muscle or whatever the patient needed. Because stem cells aren't all created equally, I would use umbilical stem cells and make sure that they're from the highest quality source possible, which is what we've done. The tissue banks are FDA regulated, and these cells go through a rigorous amount of testing through the National Institute of Health, the American Academy of Tissue Banks, American Academy of Blood Banks, so you can rest assured that the cells you're getting are healthy. If you do choose to go somewhere else for stem cell therapy, you need to make sure you know where the cells are coming from, who their provider is, and what type of stem cells they are. Stem cells are going to be equal or less than the cost of your copay if you were to get surgery, and it's certainly less than most people's deductibles. Your health savings account and flex spending account will cover stem cell therapy, but your insurance will not. And so each case is different, each patient is different, and I can determine exactly what you need and what your cost will be during the consultation. The general range is going to be between $3,500 and $6,500. With the current stem cells that we're using, we're seeing at least an 85% success rate. After your injection, there's nothing else that you need to do. As a matter of fact, we say take it easy for the next 2 weeks. We have you come in for a follow-up visit to see how you're doing with your stem cell treatment. And then if there's any additional rehabilitation or chiropractic or anything that you need, then we'll go over that at that time. Things don't change unless you change things. Stem cell therapy has the power to change whatever change you want to see in your health more than anything else available today. I urge you today to act on your impulse to improve your health, your mobility, your independence, and your opportunity to give yourself to others.